Hey guys, this is Dr. Hub. Now we look at the Plasmodium species. And we're going to compare and differentiate each of them. So first we start by the Plasmodium vivax. So Plasmodium vivax was discovered by the Gracie and Feletti. So what is the erythrocyte preference? It is going to be associated with the reticulocyte. And what are the stages in the peripheral blood? The peripheral blood stages, it includes the presence of the trophozoites. So this presence of the trophozoites. There is also presence of the schizons and the gametocytes. Next we look at the infected erythrocytes. So the infected erythrocyte, it includes, they are enlarged, and this is enlarged pale, they are enlarged pale and with the Schaffner's dots, with the presence of the Schaffner's dots. So infected erythrocytes, they are enlarged pale with the Schaffner's dots. Then we look at the gametocytes. The gametocytes are nothing but it is spherical. Gametocyte is spherical and it fills the cells. Then we look at the color of pigment. The color of pigment, if you see, this is yellowish brown. It is going to be yellowish brown. And what about the hypnozoites? The hypnozoites are present. Then what about relapse? Relapse is, yes, the average incubation period, AIP, is going to be 14 days. The duration of the erythrocyte cycle will be 48. That is a benign tertian. Next we will move on to the Plasmodium ovale. So the Plasmodium ovale, this was discovered by the Stephens. And what is the erythrocyte preference? Erythrocyte preference will be the reticulocytes. And how is the stages? The stage in the peripheral blood. This is going to be the same as in vivax, that is a trophozoites. Then comes the presence of the schizons as well as a gametocyte. So what will be the infected erythrocyte? The infected erythrocyte, it will be pear shaped. Infected erythrocyte is going to be pear shaped. It is going to be fimbricated. It is going to be pear shaped as well as it is going to be fimbricated. And then there is also presence of the Schaffner dots. The Schaffner dots are nothing but the James dots. Next we look at the gametocyte. The gametocyte is similar to, but it is smaller than the vivax. It is similar but smaller than the vivax. Next, what about the color of the pigment? So the color of the pigment, it is nothing but it is yellowish and it is brown. So it is yellowish brown. Then what about the hypnozoites? The hypnozoites, it is present. Then we ask about relapse. Relapse is also, it is yes. What is the average incubation period of the ovale? Average incubation period is same as the vivax, that is of 14 days. Next is the duration of the erythrocyte cycle. This is also going to be 48 and this is the ovale tertian. Then we move on to the Plasmodium falciparum. So in the Plasmodium falciparum, this was discovered by the Welch, and the erythrocyte preference is all stages. So the erythrocyte preference, if you see, it is present in all stages And what are the stages in the peripheral blood? The stage in the peripheral blood, it includes the ring form. There's presence of ring form, there's presence of acol form, as well as there is a gametocytes. Then we look at the infected erythrocyte. This includes, it is normal in size, as well as there is a Moriar's cleft. There is Moriar's cleft. Next we look at the gametocyte. The gametocyte is nothing but it is a crescent, banana shaped. It is crescent as well as it is banana shaped. So how is the color of the pigment? The color of the pigment is going to be black. This is all in falciparum. It will be black. Then what about the hypnozoites? Now we look at the hypnozoites. This hypnozoites is going to be the hypnozoites, they will be absent. So whereas in the Plasmodium vivax and the ovale it was present, in the hypnozoites in the falciparum is going to be absent. And let's look at the relapse. The relapse is there is no relapse. And what is the average IP? The average IP, that is the incubation period, is going to be 12. So 12, it means it is the shortest. That is, a falciparum is the shortest. Then we look at the duration. There is a duration of the EC, the duration of the erythrocyte cycle, and this will be in hours. So this is going to be 48, and it is the malignant tertian. Next, we move on to the Plasmodium malaria. So under the Plasmodium malaria, this was discovered by the Laverian. So it was discovered by nothing but the Laverian. So Laverian discovered it, and the erythrocyte preference. This is nothing but the old erythrocytes. Next, what are the stages in the peripheral blood? The stages in the peripheral blood, it includes the band forms. And then what about the infected erythrocyte? The infected erythrocyte, it is nothing but it is normal size, and there is a Z-Mann's stippling. Next comes the gametocytes. So how is the gametocyte? The gametocyte is similar but smaller than the vivax. So it is almost similar and smaller than the vivax. So how is the color of pigment? The color of pigment in Plasmodium malariae, the color of the pigment. So this is nothing but it is dark brown. It is dark brown in color. And let's say the hypnozoites. The hypnozoites is going to be absent. Then what about the relapse? The relapse will be, there is no relapse. Then comes the question on the incubation period. The average incubation period is going to be 30, that is, it is going to be the longest. And what will be the duration of the erythrocyte cycle? The duration of the erythrocyte cycle is going to be 72. There is a Cortian malaria. And what is it also associated with? So this Plasmodium malaria is also associated with the nephrotic syndrome.